One of the important subjects that we want to discuss has to do with pain relief, right? The administration of medicine to relieve pain and suffering. Keeping in mind the redemptive value of suffering, it is appropriate to give proper pain medication to relieve pain and suffering. That's a service to the human person, and it's an act of charity and love. But what we need to keep in mind is that we do not want to sedate the person and deprive them of their faculties, because they are preparing to encounter the Lord. And so out of respect for that patient who needs to prepare their heart to encounter the Lord, but also out of respect for their family who can receive immense healing from being with the patient in their final days, it's very, very important that we do not unreasonably deny patients the capacity to prepare their hearts for God and for the relationships that are important in their life.
Start low and go slow. When you're looking at pain relief, we don't always need to start with the big guns. So my motto is start low and go slow. Pain management is not a simple thing. It is not just give the medicine and be done. We do evaluate their level of alertness, and we want to keep them as alert as possible.
Of course, in the face of a terrible illness or great suffering, we're allowed to use reasonable means to minimize the suffering, the use of morphine in cases where it's called for. We don't have to go seeking suffering, and we may use reasonable means to try to avoid it, but sometimes, in spite of our best efforts, we're caught. Christ was caught on the cross. Sometimes we're caught on our particular beds of suffering. And sometimes that's His plan and His permissive will for us. We've got to trust He knows what He's about. We, for our part, can try to minimize the suffering within reason, using appropriate means, proportionate means. Certainly not anything to hasten death, because that's God's particular choice. And so the idea of euthanasia or mercy killing is not acceptable. But reasonable, legitimate, moral, medical means can be used, even if an undesired side effect of those means might be to slightly swift in the occasion of their death. For example, with morphine sometimes, or other treatments along those lines. If the primary objective is to help them to endure the suffering in a dignified way and not hasten their death, licit, acceptable, moral.